On behalf of organizing committee, it's our pleasure to welcome you, all distinguished guests, our colleagues, to today's important event, the outcome ceremony meeting for the 2023 MEP Fellowship Program. Today, we will together recap and share a memorable experience from the 2023 MEP Fellowship Program. This program will feature 12 trainees presenting their study outcomes at Yonsei University, South Korea. Their sharing promises to bring emotional story and special encouragement to all of us. The MEP Fellowship Program is not only an opportunity to enhance the professional knowledge and skill, but also an unforgettable cultural exchange journey on the international stage. You will hear story achievements and deep expression from the fellows, bringing the emotions and special encouragement to each of us. Particularly, we are honored to welcome the delegates from the Yonsei University, the University of Medicine and Pharmacy at Ho Chi Minh City, and the representative from the MEP office. The presence makes today's event even more complete and meaningful. From the Yonsei University attending online with us, we would like to introduce Professor Tran, Chair of Secretary from the Yonsei team. From the MEP office, we would like to introduce Professor Nguyen, Director of the MEP office in UMP. From the University of Medicine and Pharmacy at Ho Chi Minh City, we would like to introduce Professor Pham, Coordinator of the MEP project in UMP. Professor Ngoc, Vice Head of Scientific Technology Department, Chair of Secretary in the UMP team. And we would also like warmly welcome all the fellows and the colleges present in the outcome ceremony meeting today. To begin the ceremony, we would like to invite Professor Nguyen, Director of the MEP office in UMP, to deliver welcome speech. Please welcome on the stage Professor Nguyen.
Good morning, ladies and gentlemen. Actually, I have to do the closing remark, but there might be some urgent thing to Professor Tien, and therefore we change our schedule. But anyway, I'm very pleased to welcome remark the outcome sharing meeting of the 2023 MEP Fellowship today. First of all, I'd like to thank to not here, but Professor Tien and Professor Dat and Professor Pham and Professor Dang. For your effort, we could do this outcome sharing, not only outcome sharing meeting, but also MEP Fellowship program here. And the dear 2023 MEP Fellows, and I'm waiting for your presentation, maybe, I think, wonderful. And I could hear your experience to be at Yonsei and in Korea. But however, you started your work in late November. That is late fall November, but that is late fall in Korea. And also you spend during winter season. Was that good? That's good. Yeah, very cold, but you could experience the snow. Therefore, that is one of the good experience to you. But the weather is not so good in winter season. But however, you In Vietnam, you could not experience very cold weather, but you could experience. I think that's one of your good experience. And let me introduce my story. I also studied in the United States for 2 years. And at that time, my classmate, at that time, I was early stage of the assistant professor. But my classmate also worked as an assistant professor at Yonsei University. And most of them study abroad. But about the professors, among my classmates, not only my classmates, but also my senior professors, senior students also, when actually almost 100% of our professors study abroad, at least for 1 year, or usually 2 years, like me. But among my classmates, only 50% can do their work when what they learned abroad. More than actually my senior graduate, more than 50% cannot do their work, what they have learned abroad. Therefore, I think you have good experience for 6 months. You think also that was a good experience to you. Therefore, I think you think, okay, I have to try these things after coming back to UMP. Do you think so? I think not 50%. I think 100% of you think like that. But about 50% can do it, but 50% cannot do it, I think. Because by my experience. What is the difference? The person who can do and the person who cannot do. Therefore, I think most of you think, oh, after coming back to UMP, I have to do this kind of study. And then I want to set up these things to my department or to my faculty. You think like that. What is the difference? I encourage you, and please don't give up. You think, I cannot do. Many Korean people, my friend and my senior who studied abroad, but they think after coming back, the circumstances are different from my country and their country. Their country are developed country, but my country is a developing country. Therefore, after coming back to UMP, I cannot do. After coming back to Korea, I cannot do. Most of people think like that. But some of them think even the circumstance in Korea is not good. But I want to try. I want to try my best. I do not give up. The person who think like that, they can do their work after coming back. Therefore, the first, I want to encourage you to not give up. Please try your best here. Then you can find a way. There are many ways, but now if you think there is no way here, but I think you can find a way because Vietnam is a developing country. I think Vietnam is similar to my experience when I came back to Korea. I came back in 1993. A similar stage or somewhat lower economic state in Vietnam. But I think you could have more chance to develop yourself, not only yourself, but also your department also. And the second thing is, I'd like to encourage you to keep in touch your PI. After coming back, please continue. Please continue to make a relationship with your PI. Then they could be helpful to you in your academic career. Not only PI professor, but also the person whom you met in that department at Yonsei University. If you have the good relationship with them, then they could be in somewhat helpful to you. Therefore, please continue your relationship with them continually. I think if the chance for you to attend the international meeting will be increased more and more. Therefore, you could meet the professor or the person who work at Yonsei University. You could have a chance to meet them in the international meeting. Therefore, it is better for you to keep in touch with them. And I'd like to ask you to give a conference presentation and make a paper, whatever you have learned in Korea. And that also remind your study. I think during studying at Yonsei, you think, oh, this is a good project. I want to continue this kind of study. And if you are more interested to write the paper or to present in the conference, then you have to prepare and you have to spend more of your time. Then that could remind you about your study at Yonsei. Therefore, actually, the presentation and the writing a paper is also important to our project. But not only important to our project, that is important to your academic career. Therefore, please continue to try. Once again, congratulations to finish your fellowship at Yonsei in Korea. Thank you. Come on.
Thank you, Professor Lee, for your welcome speech. And on this special occasion, it is our honor to welcome the representative from Yonsei University, Professor Tran. Today, Professor Tran joined online with us, and Professor will deliver the congratulatory speech to our fellows and our meeting.
2023 bedfellows, great to see you again. It's been 2 months since you got back, so I think you settled back into UMP life and get busy with your routine again. But let's take a quick trip down memory lane and think back to the time at Yonsei. I totally get how hard you hustled and also how much fun you had at Yonsei. I really hope that your experience at Yonsei, especially in the early days of your professional journey, opened your eyes to new possibilities for research and clinical work. Your mentors at Yonsei had nothing but praise for each and every one of you as top-notch and passionate fellows. They have even mentioned how fulfilling it was to guide you through your scientific journey. Of course, at Yonsei, you learned cutting-edge knowledge and the latest techniques in each field. However, while you at Yonsei, one of the most important goals was to learn the way of how researchers communicate each other, covering everything from clinical to basic sciences, not only in Korea, but globally. So let's keep pushing to broaden your horizons globally by connecting with researchers worldwide and sharing insights. You do not just contribute to your own university or country, but making an impact on a global scale. And I'm sure that will be a meaningful and wonderful journey in your life in science. Thanks a lot for coming to Yonsei MAP Fellows. Wishing you all the best for the future. Lastly, I would like to express my gratitude to Professor Tang and other UMP professors who hosted this outcome sharing meeting. Also, I deeply appreciate Professor Mingle Lee and the MAP office staffs. Thank you very much.
Thank you, Professor Hong. And before to delve into the sharing session, I would like to invite our 2023 MAP Fellows to join me on the stage to receive this beautiful flat flower to tokens at of appreciation for their hard work and dedication. Welcome on the stage Dr. Đào Duy Phương, Dr. Phạm Tín Quang, Dr. Nguyễn Phước Lợi, Dr. Lê Linh Thi, Dr. Nguyễn Minh Thái, Master Nguyễn Vi Vân Thảo Ngân, Master Nguyễn Thị Hiền, Dr. Trần Thị Minh Châu, Dr. Nguyễn Ngọc Hà, and today attend online with us Dr. Nguyễn Thái Thiên Kim, Dr. Cao Phạm Hà Giang, and Dr. Hồ Đoan Trang. Please welcome. We would like to invite Professor Trần Ngọc Đăng, Professor Lee Minh Nguyen, and Professor Phạm Lê An to join us on the stage on present flower to the 2023 MAP Fellows. Congratulations to each of you for your achievements. Your dedication and efforts have truly made a difference in our program. And now let's have a group photo together. So to capture this moment as we celebrate the successes of 2023 MAP Fellowship Program, I would like to invite all of the attendees. Could you come to the stage and we will have the group photo together to congratulation for our fellows. Thank you all of the attendees, and thank you for professors and fellows. As we conclude our group photo sessions, I would like to invite Professor Phạm Lê An to continue coordinating the program. Please join me in welcoming Professor Phạm Lê An.
Yeah, today I am very honored to make a role of moderator of a project, on my project fellow. And it's the very insight present from Professor Minh Ligu. We remember 24 years ago, I also studied in America. And many of senior professor and lecturer and faculty staff in UMP go abroad, like Professor Dang and the other. But now, we would like to, the same advice from Professor Lee, never give up. Even though we still work in UMP after we receive experience from the outside. And now we would like to learn and to listen for your sharing experience. We started, and during each of presentation, we have only 5 minutes. Please remember. I will cut it. Yeah, we have a 12 presentation. Thank you. Now we will start the first presentation about deep brain stimulation and transcranial MRI guide focused in ultrasound and functional neurosurgery.
안녕하세요. Good morning, Professor and colleagues. My name is Phuong, and I'm currently a lecturer in Department of Neurosurgery. And today I'm deeply honored to be the first to share my experience from MEF Fellowship Program at Yonsei University Seven Hospital, which I recently completed. First of all, I really want to express my gratitude to MEF Project and COICA for the sponsorship and support throughout my journey. At Yonsei, I follow 3 professors specializing in functional neurosurgery: Professor Zhang Jinu, Professor Zhang Hyun-ho, and Professor Chang Won-sok. And my main senior is world Professor Zhang Jinu. He's the director of the Center for Innovative Functional Neurosurgery. He also the past president of the World Society for Stereotactic and Functional Neurosurgery and the Korean Neurosurgical Society. Firstly, I want to start with some clinical training activity. My major field of study during this course were transcranial MRI guide focused ultrasound, and this is modern technology and is not available in Vietnam, but I expected that it will be introduced in the near future. This device is equipped with 1,000 of ultrasound transducer elements, enabling the conversion the beam to target deep structure in the brain without the need of invasive surgery. And the accuracy of this procedure is ensured through the real-time thermal MRI imaging during the HIS process. Of course, we have to utilize the advanced software to reconstruct trajectory of the white matter tract and gray nuclei, meticulously planning the surgical intervention. And one of the main indications is thalamotomy for treating essential tremor. And after approximate 2 hours of this procedure, you can see the patient demonstrated clear handwriting and draw spiral, an improvement of over 90% of symptoms. So I usually participating in this surgical procedure twice a week. And during the remaining days of the week, I present at the operating room to carry out various surgery, like deep brain stimulation surgery or epilepsy surgery, and so many kinds of surgery I have learned, and so on. During the final months, Professor Trang arranged for me to undertake the internship and observation opportunity at other prominent medical centers like Samsung Medical Center or Asan Hospital or Catholic University, Incheon St. Mary Hospital or Chikok Hospital and Yonhin Hospital. At Samsung Medical Center, I have a chance to learn under the guidance from Professor Lee, who were leading a groundbreaking clinical trial on controlling metastatic brain tumor using focal ultrasound. You know, the challenges, big challenges of drug delivery across the blood-brain barriers. So Professor Lee employed the focal ultrasound to transiently open and disrupt the barrier of the tumor site and utilize the microbiome as the carrier to transfer targeted chemotherapy drug delivery to the tumor. And this is Asan Hospital and Yongin Hospital. Regarding research activity, I participating in some clinical trial in human or some experience on animal model like human neural stem cell transplantation trial for Parkinson's disease or low intensity focused ultrasound neuromodulation targeting the nuclear accumbens for methamphetamine addicted rats. Or I upload the utility of off-board scanning and the MER appearance use of chemical robot in mini pig. Interesting that I became a recruited participant in one clinical trial about transcutaneous vagus nerve stimulation in treating anxiety, insomnia, and depression through an earphone device. This is mini pig. So I also fortunate to attend numerous specialized conference and symposium both domestically and internationally. I have a privilege for learning from experts and sharing some clinical expert and research finding. And there are two conference memorable impression on me. The first is the Asian Epilepsy Surgery Congress hosted in Vietnam. In this conference, I am a secretary, so I connect some professor from Korean and Vietnamese team. And the second were the Asian Association for Transcranial Focused Ultrasound Surgery hosted in Korean, where I can learn from pioneer professor from Japan, China, India, or Taiwan. And a special significant is my interaction with Professor Ali Rezai from the University of West Virginia or Professor Elizabeth Obed from University of Toronto. In terms of writing papers, I involving in 3 small projects started by professor. The 2 first is about deep brain stimulation, and my colleagues and I have submitted 2 of them, and they are currently under review. And the third project, I focus on SEG under chemical robot supporting.
Yeah, thank you, Dr. Phuong. We are online. You look like you learn a lot and also many experience on study and writing paper. Thank you very much.
Yeah, thank you so much.
Yeah, also, thank you very much. Yeah, I would like to introduce the next presentation. Early outcome of intracorporeal and extracorporeal anastomosis following laparoscopic colectomy for colon cancer from Dr. Pham Tien Quang. Yeah, thank you. Yeah. You have a 5 minutes, please. Yeah.
Good morning, everyone. My name is Pham Tien Quang. I'm a lecturer in the Department of General Surgery at UMP. I'm very happy to be here to share my experience in Korea. In Korea, I had a chance to study in Department of Surgery, the colorectal division with Professor Byung Suk Min. He also the director of the colorectal division and also one the expert in colorectal surgery and robotic surgery. In Korea, I had a chance to study in the robotic system, and I also joined some workshop in the laparoscopic surgery on the pig. And I also joined some conference in Korea, some international conference like the robotic conference and the laparoscopic surgery conference. And this is the day we visit the College of the Medicine in the Yonsei University. There's also an interesting experience in Korea. And I also want to send my thanks to Professor Park that teach me about the scientific writing module. In this module, I can learn many things to improve my writing skill in the public international paper. I want to talk briefly about my research. My research is about the early outcome of intracorporeal and extracorporeal anastomosis following the laparoscopic colectomy for colon cancer. The aim is to compare the early result of ICA and HCA following laparoscopic. And the first result, the patient will in the intracorporeal will have a smaller incision, and they also have the faster recovery after the surgery. And we are trying to publish this paper in the International Journal of Colorectal Disease. In the Korean, I also expand my, I also invest the Korean culture. This is my friend from Vietnam, from UMP. And we also share many unforgettable memories together in Korea, like Seoul, Busan, and Nami Iceland, and the and I also had many international friends, like a friend from India, Taiwan, Hong Kong, and Tanzania. That's also my best friend. But the journey not to end. On the last day in Korea, my professor, this is my professor, Professor Byung-Suk Min, he told me that we can keep connect and we can go together, we can do further study together, and that's my best valuable thing I get from this journey. And finally, I want to say my thanks to UMP and Yonsei University and Khoika and MF that give me that chance to study in Korea and expand my experience and knowledge in my career. Thank you very much.
Yeah, oh, thank you. Your presentation is on time. It's very good. We can hear from you the learning from the Da Vinci robot system experience, and also you share with us the very good cultural showing experience, and also never give up. No, you can continue to work with your boss. Yeah, in Korea. Thank you. For the next one, I would like to invite Dr. Nguyễn Phước Lợi with his presentation about three-dimensional analysis of skeletal stability in cleft lip and palate patient undergoing bimoxillary surgery with left 4, 1, osteotomy and intravertical rasmus osteotomy. Yeah, I would like to invite. Yeah, thank you.
Good morning, everyone. My name is Lợi, and I recently completed a 6-month MEF fellowship at Yonsei University. Today, I am excited to share my journey's experience and my research I conducted during my time in here. Orthodontic surgery is a surgical procedure performed to correct abnormality of the jaw and facial skeletal structure. For maxillar, the most common procedure is level 1 osteotomy. For mandible are BSSO and IBRO. Comprehensive management for cleft patient from primary closure of lip and palate when they are 3 to 6 months years old, and to orthodontic surgery when they are more than 18 years old. But orthodontic surgery for cleft patient present challenges compared to typical orthodontic procedure due to the complexity of congenital deformity and scar tissue from the previous surgery. So we must choose the stable procedure. IBRO were considered more stable than BSSO when performed in non-cleft patients. So we performed this study with two purposes. Through 3D imaging, we were able to resize, measure, and compare the skeletal chain before, after, and follow-up that surgical procedure. This is my research. We can see the picture. This is an conclusion. Level 1 and with IBRO research in skeletal stability for left and palate cleft patient. It's in my clinical experience. During my fellowship, I was deeply involved in various clinical activities which provide me with hand-on experience in several key areas such as orthodontic surgery, oral cancer, microsurgery, cleft lip and palate closure, robotic assistant, and so on. One of the most enriching aspects of my fellowship were the opportunity to attend various conferences. Attending the lecture and workshop in this conference significantly broadened my understanding about my current trend and advance in maxillofacial surgery. Next, attending, immersing myself in English speaking academic environment, improve my communication skill with both written and spoken. I also try a lot of food as Korean, and I also try to drink the soju. It's very delicious, yes. I also met and interacting with colleagues from around the world. Not only foster my professional relationship, but also a cultural exchange and lifelong friendship. Secondly, I experience into Korean weather is amazing. My first time see snowfall, my first time experience about winter, autumn season, and my first time to climb the mountain. Inclusion, my fellowship at Yonsei University has been a period of profound learning and professional growth. I am deeply grateful to MEF, UMP, and KOICA for funding me my fellowship. And I want to give a special shout out to Professor Minh and Professor Yang Su. In conclusion, once again, I want to express my deepest gratitude to my friend, fellowship, and resident doctor at Yonsei University. Thank you from the bottom of my heart.
Yeah, thank you very much for your presentation on time, and also your personally, I think actually now you reach our objective of Math Fellow project that we learn a lot of new technology in odontology and also the cultural exchange, and almost here the winter episode in Korean. Thank you very much. The next one, I would like to introduce the presentation from Dr. Linh T. Her presentation about the access of canal water pollution, knowledge and related factors on water pollution and sanitation on the local communities. Yeah, thank you.
Good morning, Professor and everyone. My name is Linh Thi. Today, I will show the research of MEF's fellowship. The mentor of mine is Professor Kim Chang-soo from the Department of Preventive Medicine. The research topics of mine is assess the canal water pollution and knowledge and related factors on water pollution and sanitation on the local community. And the research objective is investigate the status pollution of the canal water, the knowledge and related factors on canal water pollution, sanitation and hygiene on local community living along the polluted canal. And here is some research of my research. And finally, the conclusion we found that about more than 60% of people have the right knowledge about the pollution canal, but they have only 30% people have the correct hygiene practice related health status. So we have the solution, we should improve the education for the local people to protect the water environment and give some the water-based treatment technology to keep the environment from the canal water. And next, thanks to the support of Professor Kim and the MEF, I have an oral presentation at the first international conference on the practice zero emission technology and strategy in Vietnam. And during the 6 months, we have a chance to have academic writing class with Professor Park. This can improve our writing skill for the paper, and I very interested with this class. And next, some free time, we have a chance to together with friends, and this is the picture we have the New Year Day in the Lotte Tower, and some field trip with the group under the guidance of Mr. Lee at the Everland and Iceland. And finally, I would thank the UMP and the KOICA and the MEF to give me a chance to meet many friends and to have a chance to study at the Yonsei University. Thank you so much.
Yeah, thank you so much for your on time. And also, your Dr. Linh, her presentation contribute to a very important issue now. We deal with the climate change in Vietnam and also in Asian country, and also air pollution and water pollution is also a very important issue. Thank you. The next one, I would like to invite Dr. Nguyen Thái. His presentation about the deciphering the recombinant nanobodies to produce of E. coli through the cell-stocking toolbox. Yeah, please. Thank you.
Hello, Professor. Hello, colleague, and hello, everyone. Today, I would like to present my research outcome in Yonsei University, which title Deciphering Recombinant Nanobody Reducing E. coli through Single-Cell Approach. So the research was performed at the Department of Pharmacology, College of Medicine, under the guidance of Professor Kim So-young. So first, let me introduce about brief information about introduction. So first, I would like to read you some brief information about the nanobody. So nanobody is the tiny recombinant antibody, and they can specific binding to the specific epitope in antigen. So compared with the monoclonal antibody, the nanobody has some advances, like they have the MON size about 15 kilodalton, and partially they have the high affinity compared with the traditional antibody, and they can easily to reduce in E. coli and even in plant in a mammal cell culture. So this is the reason why I say that the nanobody is the research bit at young stage. So we have that the first experiment about the nanobody happened in Brussels University on 1993, and until now we have the first approval of nanobody from FDA, so-called Cavalier. So traditional, we need to inject the antigen to the animal to reduce the library, and then from that library we can make the reading step to reduce the nanobody. But we see that we have the disadvantage here, the diversity of the library is very low. So in the Yonsei University and in the lab of the Professor Kim, they already developed the new library, and we call it synthetic library, because we don't need to use the animal in this case. And we also get different kind of the structure of the nanobody, like concave, flop, and convex, and the diversity can increase until 10 equal 12. And based on that library, I started to reading the nanobody to target on interleukin 17, and we also get some colony at the end, and we try to reduce a little bit nanobody in E. coli, and we also try to develop the toolbox to early reading the outcome of the library, like we will over-address the interleukin 70 receptor A in SEK cell line. And we also see that the chemical antibody can increase a little bit the signal, but our library still have just a little bit signal. So this is the reason why we want to use computational approach to improve the binding affinity. And when I come back to Vietnam, I would like to make like further application. We will integrate the nanobody to the chip or in the transistor to develop the new biosensor, or even we will develop the cell, the blood delivery in this case. So finally, I would like to express my deep gratitude to UMP leadership, to MEP staff and all the professors, particularly Professor Kim. She already guided me a lot, and she already helped me to reorient my research. And also, I would like to thank to all the members of the lab. They already helped me a lot in during my experiment. So, thanks for listening.
Yeah, thank you for your presentation all time. And Dr. Nguyen Thái, his presentation about the nanobody is very important issue in the genetic research in Vietnam and also in the world. and he's sharing with us many experience. And of course now, he never give up now with his plan in when he returned to Vietnam. Congratulations to him. Thank you. Yeah. The next one is the presentation number 6 of Dr. Nguyễn Thái Thiên Kim from Faculty of Pharmacy. Her presentation about joint effect of inflammatory dietary patterns and physical activity on the risk of depressive symptoms, a nationwide cross-sectional study. Yeah, maybe she on time, online. Thank you.
Hello everyone, my name is Kim. I'm a lecturer at the Department of Clinical Pharmacy, UMP. Today it is my honor to attend this outcome sharing meeting. As a fellow of the cohort of 2023, it is my privilege to share my experience learning and working at Yonsei University, my research outcome and my cultural experience and friendship here in Yonsei University. Well, my fellowship mainly took place at the Department of Preventive Medicine under the supervision of Professor Chau, and I really admire Professor Chau, my supervisor, for her expert in epidemiology, in method design, and she is also an editor from the Yonsei University Journal of Medicine, and I think that I have learned a lot from her for evaluate the value of a publication or manuscript. And at this department, I have a good opportunity to access the Korean National Health and Nutrition Examination Surveys, or the KNHEN database, which is among the most high quality database of the Korean government. And I have learned a machine learning model to analyze this database. And another part of my fellowship is to visit the College of Medicine, where I can learn from the experience of Yonsei University for educating medicine students. And the other important part of our fellowship is to attend the scientific writing classes, which I really enjoyed the acting learning vibe here. And after 6 months of hard working at the Department of Preventive Medicine, I finally complete my manuscript titled Joint Effect of Inflammatory Dietary Patterns and Physical Activity on the Risk of Depressive Symptoms, a nationwide cross-sectional study. In our study, we aim to examine the interactive effect of physical exercise and the inflammatory diet on the risk of depression in Korean adults. And compared to previous study, our study have the advance of the national representative sample of the KNHEN, which is a high-quality database, and we also utilize a machine learning model called Bayesian kernel machine regression. And here is a few slides of our result. In our study, we include a total of more than 4,000 participants, and our study is the first one to illustrate the synergistic effect of diet and exercise on the risk of depression in adults, and we found an additional of 36% of risk of depression when a person is having inflammatory diet and insufficient physical activity. Notably, thanks to the advance of the machine learning model, we were able to identify the effect of each nutrient among the 22 nutrients and the combined effect of all the nutrients at the entire diet. And we compare participants with sufficient physical activity and insufficient physical activity to identify the joint effect of diet and exercise. And now we can see here individuals with insufficient physical activity exhibit a substantially greater risk of depression posed by pro-inflammatory diet, while they did not benefit from anti-inflammatory diet in terms of the risk of depression. To that, we have submitted our manuscript, and it is under review by the British Journal of Nutrition. And I also have attended the Cell Symposia, an international conference in Lisbon, Portugal, and to have a poster presentation for our project. And finally, I would like to share life experience during my fellowship. And you know that research life may be very stressful for everyone. However, I can always find the healing cell study place in Yonsei. And to me, Yonsei University is among the most beautiful university I have ever been to. And I believe that I was so lucky to explore it in both autumn and under the snow in winter. The 6 months in Seoul to me was a good opportunity to explore the culture of the Korean, and I totally fall in love with Korean food and the traditional grace of the Korean woman, and I am so fascinated by the stunning view of the ancient palace, which is just inside the city, and I really love to hear the rich history behind every corner of the palace. Last but not least, I really appreciate the friendship with other fellows, and I am grateful to have them all with me in this period of time with different backgrounds in medicine, dentistry, nursing, public health, or for me, pharmacy. We are more than happy to share our point of views and the professional experience. We also share our memorable journey with so much love and joy, and we feel very young and energetic living in Yonsei University. In short, this wonderful trip had helped me to improve my research capacity and brought me a lot of interesting cultural experience and friendship. Finally, I want to express my sincere thanks for Yonsei University for the MEF fellowship programs for KOICA and UMP to make this trip wonderful to me. Thank you.
Yeah. Thank you. It's a wonderful presentation from Dr. Nguyễn Thái Thiên Kim. She have got three partner of our objective. Besides it, she shared with us the very important issue in preventive care with the joint effect of two risk factors on the depressive symptom based on the Bayesian kernel model. This is a very important work based on the big data in data science and also with the learning machine. I hope that she never gave up, and when she returned, she continued to work with our new field data science in UMP. Thank you. We reached the presentation number 7 from Mr. Nguyen V. Văn Thao Ngan about the nursing student stress and satisfaction with clinical practice education in Vietnam. Yeah, thank you. I would like to invite Mr. Thao Ngan.
Good morning, professors and everyone. I'm here today to reflect my research practice and share some interesting experience from my journey. Firstly, I would like to talk about my research. Students experience prolonged and high level of stress. It can have negative impact on their academic, physical, mental, and social performance. In addition, research evidence emerged that nursing programs, including clinical practice, can be highly stressful for learners. Therefore, this study aims to examine the stress level of nursing students and their satisfaction with clinical practice, as well as explore the relationship between these two factors. The questionnaire is specifically designed for nursing students and comparative domain. In t-test and multi-variate linear regressions. The next research-focused treatment objective. Firstly, according to the research findings, students experience moderate level of stress in their clinical practice. Among the aspects of stress, witnessing the pain and suffering of patients were found to be the most stressful. And some evidence showed that being overly sensitive to the pain of others during the care of patients can lead to harmful effects, such as exhaustion. The next, assessment of satisfaction with clinical environments at hospitals result is in quite a high level. based on the linear regressions for change in clinical practice. Gender and satisfaction serve that significant predictor. Collocation. As this research laid the foundations for further students to determine the factors that can enhance quality of clinical environments, thereby preventing prolonged change in students. They lead to the better competence for cleaner, which can ultimately cater to the needs of medical personnel in the future. Secondly, I would like to talk about my emotions regarding to the trainee. I had the opportunity to attend conferences with my professor, who is enthusiastic as well respected. She Professor Lee Terwa. International conferences are more than just formal gatherings. They provide the first-hand insight into the latest developments in my field. During that time, I also had wonderful experience discovering the unique aspects of Korean culture and indulging in Korean cuisine with my team. The following sessions represent my outcome. Thanks to funding of CORECAI, I had a great opportunity to attend the eForms conference, which were a highly interesting experience for me. My oral presentations at these events obtained positive feedback from a diverse and knowledgeable audience. And I'm currently in the process of refining the manuscript and look forward to publish it on an international level. At the end of presentations, I would like to express my sincere gratitude to CORECAI for their valuable contributions to my research. I'm hopeful for further collaborations with CORECAI on numerous upcoming projects. Thank you to UMP and Yonsei for providing me with the necessary conditions to participate in the MEF project. And finally, thank you for taking the time to watch my dissertation. Thank you.
Yeah. Thank you very much for Mr. Nguyen Vi Van Thảo Ngan presentation on time. She's the first in faculty nursing and medical technology. Also contribution to the diversity and also about our MEP fellow membership in 2023. And also she contributes her research on the medical education field, also in how to take a consultation for students when they have a stress, based on the stress and satisfaction. Thank you very much. Now we move to presentation number 8 from Mr. Nguyen Hien. She also from Faculty of Nursing and Medical Technology about the development and effectiveness of web-based on colorectal cancer caregiver in Vietnam. Yeah, I would like to invite Mr. Nguyen Hien. Yeah, thank you.
Hello everyone. Today I would like to share my great experience when during 6 months I've been in Korea, and my project when I submit to MEF program is the development and effectiveness of web based on colorectal cancer caregiver in Vietnam. First of all, I will present my project. One is will to develop the web projects. I conduct 2 research. First one is the qualitative complementary research to investigate the needs of the caregiver of colorectal cancer. And from that data, I write I write the manuscript. Now the manuscript is finished and we send for editing with my professor in Korea is Professor Lee Han-kyu. And in addition, we also make the poster to present in international conference in Hong Kong. And the second project is also we conduct before we develop a web. So we conduct the data research to collect data for the depression and the coping strategy of the caregiver. And for this data, we finish the manuscripts and we also submit to the nursing open journals. And now we under the review, and I hope that will be submitted recently. And the project 3 that when I work in Korea with my professor and my lab, when some lab meeting, we discuss and we develop the new projects that we validate the scale called the Promise 29 is evaluate the quality of life of the cancer patient. And during in Korea, I also do some steps to get the IRP permission, and we make the team. And now when I'm back to UMP, we have the team and we collect now more than 200 population. And I hope that we finish the data collection and write paper next time. And during we spend 6 months in Korea, we also spend time to participate in very important class that I choose because I want to write the scientific manuscript and submit to international paper. And also because I also work as a team in UMP, so I participate to scientific leadership and management who conduct by my professor Lee Han-kyu, and the qualitative research for publish, and also the communication in class, but actually it's the writing class. So I think it's very effective for my research and for writing for international publish. And I also have the good chance to participate to 2 international conferences in Korea. First one in Yonsei, and the second one in a very big hotel outside Seoul. And I think that, and the other when I just come back to UMP and in conference in Hong Kong in March, and by participating in 3 international conferences that I think I learned the trend of nursing topic and also know how to write paper and how to publish. The final one is besides that, I also have many time to travel around Korea and explore culture. I also very good experience with sometimes it's called Hoa Dam Forest. And actually we have time to climb to the Sarak mountain. It's the highest mountain in the very cold weather, and it's amazing experience. Finally, I want to say thank you for every program for UMP and Khoika and Yonsei that support me a lot to have the great experience and great knowledge to be develop myself and my research in the future. Thank you.
Yeah, thank you very much for your presentation on time. And actually now, very impressive for your work in the same period of 6 months, but you finished 3 projects. Congratulations to you. And also your experience sharing in qualitative research methods is a very important tool for nurse and even though for another faculty staff to study in the future. Thank you very much for your sharing. And the next one is the presentation from Dr. Nguyen presentation number 9 about the vitamin D suppressed keloid fibroblast proliferation through WNT58 signaling pathways. Yeah, thank you.
Good morning, professors and everyone attending here today. My name is Nguyen, a dermatologist under the guidance of Professor Chu Hee Lee. Today, I will be presenting my project result. Vitamin D suppresses keloid fibroblast proliferation through Wnt5a signaling pathways. As we know, Wnt signaling pathway, there are two main pathways, and many studies pointed out that Wnt5a is usually associated with non-canonical pathway. Therefore, I performed many preliminary experiments and got some results. In keloid fibroblast cells, the canonical pathway is downregulated compared to that of human dermal fibroblast cells. In contrast, the non-canonical pathway is upregulated as expressed through augmented of Wnt5a and its calcium pathway. According to this paper, vitamin D receptor is common receptor of vitamin D and Wnt5a calcium pathway. Based on this initial knowledge and result, I come up with the hypothesis if if vitamin D can inhibit Wnt5a signaling pathway through its similar receptor, therefore downregulating the downstream signal. Through cell viability assay, I chose two concentrations of vitamin D, 50 and 100 nanomolar. I will show you some initial results. On the one hand, concentration-based RNA expression fold change. And on the other hand, time is also an important factor that accounts for RNA expression change when treating vitamin D in keloid fibroblast cells. To summarize the result, firstly, vitamin D 15 nanomolar treatment displayed better inhibitory result on Wnt5a pathway after 48 hours compared to those of 24 hours. And the second, vitamin D 100 nanomolar treatment also demonstrated good inhibitory outcomes on Wnt5a pathways. However, the 48-hour duration didn't seem to be superior to the 24-hour duration. During the past 6 months, I already have performed many techniques and experiments, such as cell thawing, cell freezing, tissue grinding, do RNA extraction, do nanotroph, and cDNA synthesis, and do real-time PCR. More importantly, I also got many interactions and exchanges. It was really blissful when my professor Van Thế Trung, who supported my accepted into MEF fellowship, paid a visit to Yonsei University, and we also took a picture to commemorate this occasion. Besides, I also have many chances to join lunches with Professor Young In Lee and other lab mates. This is the dermatology department year-end party and the research article class. Actually, Korea is a beautiful and exotic country to behold, and I would like to express my
sincere thankfulness to MEF Fellowship Program staff to always also answer all my questions and handle all the problems related to accommodation and study when I first came to Korea. This trip to the Garden of Morning Calm, trip to Everland, trip to Busan. This is the end of my outcome sharing. Once again, I would like to express my profound appreciation to my Professor Lee Chu-hee, and another I want to pay tribute to Professor Minh Lee and Professor In Hong Choi for your enthusiasm in adjusting the timetable to suit me better. Thank you everyone.
Yeah, thank you for Dr. Nguyen Ngọc Ha's presentation focused in the lab activities in the MEF Fellowship. And now I would like to introduce the presentation number 10 from Dr. Pham Giang, online about the burden of respiratory syncytial virus in Southeast Asian pediatric patients, systematic literature review and meta-analysis. Thank you.
Good morning. I'd like to extend greetings to the esteemed professor from UMP and Yonsei University, and to all of you here, my friends and colleagues. I'm Dr. Giang from the Department of Pediatrics. I'm apologize for not being able to attend the event in person due to a scheduling conflict. For me, achievements is not only about knowledge, research, or a paper, but also about rich emotional experiences. That's why in my slideshow, I've included many photos I took during my journey, so you can get a comprehensive understanding of my study trip to Seoul. These photos show Yonsei University, Severance Hospital, and the pathway I walked through every day to Severance Children's Hospital. Unlike other fellows in the program, my training course lasted only 2 months because my professor needed to transfer to the USA for his career development. Initially, I thought that with such a limited time, conducting a study would be impossible. However, my wise professor had a plan, and fortunately, it was exactly what I wanted to learn at that time: the systematic review and meta-analysis. Not only that, but the topic he chose was also my favorite, RSV, since newly RSV vaccines has recently been approved. So we conducted a systematic review and meta-analysis on the burden of RSV among Southeast Asian children. Through our search strategy, we identified over 1,000 studies. After removing duplicates, over 800 studies remain for abstract screening. Luckily, I received support during this strenuous stage from Dr. Lee Yi-young, a fellow in the infectious department. We assessed 213 studies in Phuoc for eligibility and finally included 105 studies for relevant data extraction. These photos I took in the garden inside the hospital. The primary outcomes were the proportion of RSV-infected cases among children with acute respiratory infection in Southeast Asia. Here you can see the proportion of RSV in each Southeast Asian country and the overall. These photos show places where I conducted my research, the library and the self-study room. The first secondary outcome was the hospital admission rate, which was about 30%. The next secondary outcome was the proportion of severe RSV cases, including cyanosis, hypoxemia, and oxygen requirement. This photo is of the infectious department where I practice every day. The third secondary outcome was the proportion of very severe RSV cases, including ICU admission, intubation, and mechanical ventilation. This photo shows the place where I presented every day at 9 a.m., the working area for doctors in the infectious department. The last secondary outcome was the RSV case fatality rate.
This photo was taken in my room. You can see the snow outside. I thoroughly enjoyed the view. During the training, I attended various classes and conferences both inside and outside the hospital. This slide shows my daily activities. Every morning we discussed about patients' conditions, followed by patient examination rounds. In the afternoon, we had meetings with the Department of Cardiology, Biology, and PICU. This was our lab meeting, where I had the opportunity to participate in an experiment on Japanese encephalitis virus. Here you can see the result of the virus culture on my serum specimen before and after vaccination. And save the best for last. Please meet the person behind my engaging and inspiring training who has earned all my admiration, respect, and appreciation. My supervisor, Professor An Yong-gyun. This photo was taken with my family visited Seoul. This one was on my last day there. This is my entire working team, and the last photo was taken at a farewell party for Professor An and me. I would not have enjoyed my studies as much without them. They are the most memorable and valuable part of the trip. Thank you for everything you've done for me. Finally, I'd like to express my gratitude to MEF, COICA, and UMP for giving me this precious opportunity to learn and experience.
Thank you very much for the presentation from Dr. Giang about the very important evidence-based issue about the systematic literature review about RSV in infection in pediatric patient. Now it's on time for the presentation number 11. I would like about Dr. Trang Minh Chau. Her presentation about the association between dietary calcium intake and the risk of cardiovascular disease (CVD) in both menopausal Korean women. Yeah, thank you.
Good morning, ladies and gentlemen. My name is Trang Minh Chau. I'm working at the Obstetrics and Gynecology Department. It is my great honor to be here sharing my last 6 months in Korea. Firstly, I would like to say thank you to MEF program and UMP for allowing me and giving me this opportunity. Through these 6 months, I can strengthen my research capability with all of my friends from UMP. And every day I had the opportunity to maintain my clinical experience in the infertility clinic, which is I can observe and do some clinical practice. And I would like to say thank you to my professor there, although she's not my mentor, but Professor Kim Hee-yeon is my respected mentor in this clinic, the IVF and infertility clinic. And I would like to say thank you so much to my respected Professor Seo Sok-kyo, and he is my main supervisor, and he encourages me to do robotic surgery and conducting research. And this is the first time I have observed robotic surgery in gynecology aspect. So there has been no robotic surgery in gynecology in Vietnam. So he said to me that if you can set up the first robotic surgery in Vietnam in gynecology department, please invite me and my group. I will help you. So I said that it is definitely yes, because it is my great honor, and my department, we will invite the whole group to Vietnam in the future. And lastly, I would like to say thank you to my colleagues. We are 12 members in the same university, and we became together within 6 months, and we become a whole big family. I really appreciate all of your help, and we maintain to be a big whole family together in the future. We spent together my first autumn and my first snow ever, my coldest winter in my life in Korea. And in the first day of April, there was the first cherry blossom blooming season in Korea. And on the second day, my paper was accepted to published in Nutrients, which has the impact factor 5.9. So the name of the paper is the association between daily dietary calcium intake and the risk of cardiovascular disease in postmenopausal women in Korea. I would like to say thank you to my co-first author, fellow Chae Kung Lee, and my supervisor, Professor Seo Sok-kyo. And so this is the last photo of my presentation, and this photo reminds me of the way to the Incheon airport. And this is the bridge to the connection of UMP and Yonsei University and Math Fellowship Program. Thank you so much.
Yeah, thank you so much for the presentation of the Minh Chau about the infertility and Da Vinci robot system. And now we come with the last presentation, number 12, from Dr. Ho Loan Trang, about the predicting the risk of developing visceral hemorrhage related to diabetic retinopathy based on deep learning model. Yeah, online. Yeah, thank you.
Good morning, everyone. I'm Doan from Ophthalmology Department. It's an honor for me to be here presenting what I have gained after a 6-month course. My presentation includes 3 parts. There are research and its outcome, clinical experience, and what I learned about Korean culture. Firstly, I would like to talk about the research field. I was provided with a writing course where I learned about how to write an academic paper and the common mistake that should be avoided. Regarding outcome, I had one presentation is on a poster at the 131st annual meeting of the Korean Ophthalmological Society. My main research title, predicting the risk of developing visual hemorrhage related to diabetic retinopathy based on deep learning model, is currently in the data analysis phase. Secondly is clinical experience with advanced techniques that I'm proposing to apply in ophthalmology in my country. These include brachytherapy for the treatment of melanoma. Currently in Vietnam, the only treatment for choroidal melanoma is enucleation. Brachytherapy, which is widely used around the world, offers beneficial treatment and ocular preservation. The second one is about the treatment of intraocular lymphoma. Currently in Vietnam, the disease is treated with external radiotherapy with extreme side effects. Methods such as intravitreal injection with easy local chemotherapy, promising more effectiveness and fewer side effects. And the last one is photodynamic therapy. It's a form of ocular laser treatment that affects choroidal vessels in the eyes. Besides academic learning, I had the chance to discover some beautiful sites in Korea, such as Jeju Island, Nami Island, and hiking some mountains in Seoul, so that I have a chance to learn about Korean culture. There's all wonderful trips. Finally, I would like to say thanks for the opportunity for me to join the MAP course. Thank you for your listening. Thank you so much. 감사합니다.
Thank you so much for presentation from Dr. Minh Trang. And now, after 12 presentation, we have the sharing experience from our speaker about multidiscipline and the diversity of field from lab to clinical science, from data science to social science, and also now we move to the Q&A. We have a 10 minutes for our audience here and also for our speaker. Thank you. Yeah, thank you. I would like to invite Professor Minh. Yeah.
Thank you for nice presentation, all of you. You have a wonderful experience in Korea, not only to have academically, but also culture experience also. Actually, I have a question to all of you, but especially to the dermatologists, because I am a dermatologist. Okay. Actually, your research is related to basic research compared to other person. I think it is better for you to come back to continue your basic research in dermatology field. And my question is, you check the effect of vitamin D in the fibroblast of the hypertrophic scar and the keloid. You check the fibroblast of the keloid or fibroblast of keloid and hypertrophic scar. Did you check both?
Thank you for your question. I just checked the keloidfibroblast, not
Keloid hypertrophic, yeah. And is there any? The first question is, what is the reason why you want to check the vitamin D effect on keloid? Was there any report? The vitamin D is related to keloid making or improvement. Is there any relation between keloid and vitamin D?
Actually, vitamin D, I already conduct research in Vietnam in serum vitamin D in serum in keloid patient, and the result is the vitamin D in keloid patient is lower than the control. And some I searched one paper that they treat vitamin D intralesional, and they also got some good result. So that's why I want to check that if vitamin D can affect on the keloidfibroblast expression. And therefore, maybe in the future, I will conduct the clinical research to check the vitamin D is if vitamin D can inhibit the development of keloid patients.
Interesting. And then I think there might be in the country who expose the sunlight more than compared to the country where the sunlight is low. Then there might be the change of the calcium level in the blood. And the sunlight can induce calcium to make the calcium. And if the calcium is related to make a keloid, then might be difference between the keloid development according to the country, where exposure to sunlight more and the sunlight less. But that is other kind of clinical. Yeah, clinically, I think if the calcium is related to keloid development or not keloid regression, then I think you could think several things in clinically to check.
Yeah. In the clinical research, I also try to compare and want to reduce the affection of sunlight by compared to the control, which is a similar, which has similar basic characteristic with the keloid patients. Yeah.
Thank you.
Yeah.
Thank you. And the neurosurgery.
Yeah. It's my research. And
Okay, you learned the functional neurosurgery.
Yeah.
And after coming back, can you apply the surgery in your department?
Yeah, thank you, Professor Lee Min-gorn. I'm a functional neurosurgeon, and when I learn in residency program, I also do the surgery, especially in deep brain stimulation surgery with my senior professor in Vietnam. And one of the important reasons why I chose my senior professor in Yonsei is Professor Giang is because he is a big name all over the world about focused ultrasound. And as I present in my presentation, that in Vietnam we don't have this machine because this technology is so new and advanced. But my hospital have a plan for the next year or really near future. The Vietnam will have the first one machine, and I think me and my team will become the first team can apply this good technology for Vietnamese patients. Yeah.
Yeah, thank you. Yeah, thank you, Professor Lee. And do you have any questions from among our speaker? Yeah, I would like to ask the question from Dr. Nguyen Tien Kim. Yeah, so interesting and so impressive to hear from your presentation about the joint effect of inflammatory dietary. It's very important in the research new method. You use data science with the big data on the national. Do you believe that when you return to Vietnam, you continue to work with the same model, Bayesian kernel model? That means that you can work independently, or you can work with the team in Korean. Thank you.
Yeah, thank you, Professor Pham for your question. Yeah, I find very. This is my pleasure that I can learn about data science in Korea, and I think that in Vietnam we are also building many more database. Just like actually the Hien database that I use in Korea is like a resemble of the enhanced database. So I think that in the future, in Vietnam, we gonna have big database with high quality, just like the K-enhance of the Korea or the enhance of the America. So I think that both it is like a good opportunity if I can access the data from abroad, and even maybe in the future, maybe somehow I can be one of the pioneer team on building such high quality database in Vietnam and use the database for our own people, our Vietnamese people.
Yeah, thank you very much. Yeah, now I announce to all of you that based on the sponsor of the MEF office and project, our UMP, we have one, I think, big computer. They can do the data science analysis, and also we need the team like you in UMP. When in the future, I hope that GIC Grant and Innovation Center, we have a good collaboration with you and another group. Thank you.
Yeah, thank you. That is such a good news. Thank you, Professor.
Yeah, one more question from to Dr. Linh. Yeah, your presentation about the access canal water pollution, just about the access, the knowledge, and related factor. Do you have any major or evaluate major for canal water in the real time in your project? Yeah.
Yes, that's right, Professor. This is the analysis from the real water canal in the 5 main channel in Ho Chi Minh City. Yes.
It's very good. Yeah. That means I believe you can continue to work with water, air pollution, water pollution, and also air pollution. Yeah. And I hope that in the next September, we have the BBC International Conference about the air pollution and water pollution. I can, I would like to invite you to join with us. Thank you.
Yes, thank Professor so much.
Yeah, thank you.
Hello, MEF. I am Minh. We are in MEF 2024. Now we live in Korea. Can I have questions?
Yes, please. Yeah.
Yes. At first, I want to say that all the presentation is very, very significant, and we kind of spread out because we have to work hard to be like them. So I have question for Dr. Wang because I work here like a surgeon as well. So I have question for you. So, what is the lesson that you can apply for the critical? I mean, that for the clinical situation in Vietnam regarding to the surgery that you learned here.
Yeah, thank you. Yeah, Dr. Wang, please. Yeah, can I answer to you?
Hello. Oh, I'm Dr. Quang, and thank you for your interesting question. Actually in Vietnam we also do on most of what my professor do in the Korea, and the most of thing I learned from my professor is how to organize the data to have a good result and public the paper. And about the clinical experience, I think I can learn some new technique that that's some technique I can apply to my hospital, but some advanced technique that I think I need a short time to get the method and get the machine to apply in Vietnam. So that's my experience.
Thank you so much for your answering. Thank you.
Yeah, thank you, Dr. Dũng.
So good morning. So can I ask question, Dr. Tien Kim? How can you access to the system to get the information about systemic review? Because in order to write an scientific article, we need a lot of information. So I would like to learn from you, how can you access to the system to got the all of information for you?
Sorry, I want to make clear about your question. Like, you want to ask about like systematic review on original research. It's like because my paper is original research. It is not a systematic review.
So I don't know from you, one of the doctor working on the systematic review. It's not you?
No.
Yeah, Dr. Pham Giang. Yeah.
Pham Giang. Okay. So sorry.
Yeah, no problems. Yeah, no worries.
Yeah.
So,
What
Dr.
is your
Hazang,
Dr. Hazang?
can
You
you share
online
with us how to access the information that we can got some literature review or something? I'm interested in your work, Dr. Hazang.
Yeah. Well, I'm sorry. I'm in the public now, so not it's outside. But first, we have a study about searching, and we search on the PubMed and Web App Science and Medscape. Yeah, and then we include on the study into confidence that an app for systematic review. Yes, and then we screen the data by reading on the abstract from the studies, and we choose the appropriate study that have relevant data about our research. And then after excluded on the not relevant study, we will read the full test and then extract the data.
Okay, thank you, thank you.
Yeah, thank you. That's a last question because we are limited of time. And now I think our Q&A we finished now.
Thank you so much, Professor Phạm Lê An. And and now Professor An will deliver the closing remark for our MEP Fellowship outcome survey meeting.
Yeah, ladies and gentlemen. First, I would like to say with our honor and deep appreciation to Professor Mingoli, devote the time to our MEP project. And his presentation in Vietnam also that guarantee for the success of our project. And also for the MEP project and Professor Nguyen, because and all of the professor in Yonsei Uni. And now we are in more than the half of the time. We remember at the first, we have to very touch time to convince that UMP can have got that project. And now we very proud of, we have all smart with the 4 components. And with the role of coordinator of that project from Vietnam and with Professor Minh Lee, we work very hard for, and with your work today, we share the experience and also the emotion, the learning experience. And we appreciate for Koika also give us the sponsor and also the experience. And now, after 12 presentation, with a multidiscipline, with the diverse of the field, we hope that the same of the advice from Professor Mingoli at the first, never give up. And now, when you return, look like I remember 24 years ago, when I returned from America, the same with you. Many luxury, many good professor. And now, we are alone. Yeah, but, remember now, you are not alone. Yonsei and Professor and also UMP continue to work together because we have a bridge that you, all of the MEP fellow, build it up now. The good relationship with our professor in Yonsei, with the cultural exchange, and I believe in the future, I remember at least 4 of you can continue to work in Vietnam with your project. It's a very good signal for the map project. Very promising to us. And we continue to work with the publication of the international paper. And also your contribution to the younger generation for our students here. And I would like to say thank you for all of you to participate online, on site in this very important event. And last but not least, to thanks for Koika, for Yonsei, and for all of the team here of MAP office and UMP contribute to a good relationship between Korean and Vietnamese people. Thank you very much. Yeah.
Thank you, Professor Phạm Lê An. Ladies and gentlemen, with that, we have come to the end of our outcome ceremony meeting for the 2023 MEP Fellowship Program. On behalf of the organizing committee, I would like to extend our sincere gratitude to all of you for your participation, enthusiasm, and support. Thank you once again, and hope to see you in the next event of the MEP project. Thank you so much.